Hello, my name is Dr. Olayiwola. I'm the Chief Medical Officer of Community Health Center, Inc., which is the largest network of health centers in the state of Connecticut. Every year, we deliver over 700 babies in the state of Connecticut, and I'm very excited to talk about a new program that's been designed to help women and new babies. Text for Baby, which is found at www.textforbaby.org, is an innovative approach to delivering vital health information to mothers at various stages of their pregnancy and during the first year of life for their babies. It is a free program, and if you text the word baby or the word bebe in Spanish to 511411, you can get 2 to 3 text messages a week, which will be relevant to the stage of your pregnancy or the age of your child. It's a very exciting program, and I have been fortunate to benefit from it as a patient using the Hello, my name is Dr. Olayiwola, and I'm the Chief Medical Officer of Community Health Center, Inc., which is the largest network of health centers in the state of Connecticut. Every year we deliver over 700 babies throughout the organization, and I'm very excited to talk about a program that is designed to provide good maternal-child health for both the mothers and the babies. This program, Text for Baby, which is found at www.textforbaby.org, is an innovative solution to providing text messaging information. This program, which is found at www.textforbaby.org, uses text messaging to provide vital health information to mothers at various stages of their pregnancy and during the first year of their child's life. By texting the word baby or the word bebe in Spanish to 511411, women are able to receive free messages through their texting program that does not take anything away from their cell phone minutes or their cell phone text messaging program. These messages are right on time, and I've been so impressed with the caliber and quality of the messages that are delivered, both as a physician giving that information to my patients and as a mother of a newborn baby. Here's an example of someone who benefited from the Text for Baby program. Hola, yo soy Doctora Olayiwola, soy el jefe médico de Community Health Center, Inc. en Connecticut. En esa posición, supervisar médicos, enfermeras y parteras para estarme segura que obtener y ofrecer la más calidad de nuestros pacientes. Yo estoy muy entusiasmado para hablar sobre un programa nuevo. El nombre es Text for Baby a www.textforbaby.org. En este programa, es gratis, es muy importante para obtener información vital a mujeres cuando están embarazadas y después de dar a luz. En este programa, después de registración, puede recibir 2 o 3 mensajes cada semana en inglés o en español. Después de texto bebé en español a este número 511 y 411. Después de ese, puede recibir mensajes, textos. Let's see. I was actually on a roll. Yo soy Doctora Olayiwola, el jefe médico de Community Health Center, Inc. en Connecticut. Estoy aquí para hablar sobre un programa nuevo, Text for Baby. Este es a www.textforbaby.org. Este programa es importante para dar información vital a mujeres cuando están embarazadas y después de dar luz por los niños. Los mensajes están gratis. Cada semana recibió 2 o 3 mensajes de Text for Baby. Los mensajes dile información importante depende de la parte de embarazada que tiene. El número para usarlo es 511-411 y cuando texto eso puede poner bebé en español y va a recibir mensajes en español. El programa es totalmente gratis. Aquí es una persona que se beneficiaron de este programa Text for Baby. So I signed up for the messages because I know that pregnancy is such a challenging time in people's lives. There's so much information that you need and so much information that's difficult to get. And I thought Text for Baby would be a nice place where you could get all that information centrally in one place, and the messages will be given to you at the appropriate age or stage of your child or the stage of your pregnancy. And I think that's important because when you're pregnant, you're trying to figure out how do you go through all these different books and websites and materials that are available, and they're not always given to you at a stage that's relevant to you at that time of your pregnancy. So that's why I thought it was important to sign up. But also kind of on a national level, and I'm wearing my public health hat, we know that less than 2/3 of women get into prenatal care in their first trimester, particularly when you get into racial and ethnic minority communities and underserved populations, it goes down even lower. So if we're not even accessing women in that most important part of their pregnancy, then we can't even get them the health information. So by having them sign up, if you can reach them using what they do already, it's natural. Most of our young mothers and our mothers these days have text messaging. They do text, they communicate via text. Why not just reach them the way that they like to be reached? And that's why I think it's an important program. I think the part of the problem that we have right now is that there's not a lot of good access to care for young women, particularly young women of color, and particularly young women of color who are not insured or don't have access to health insurance. But the reason why is that we have not penetrated, as a primary care kind of culture, have not really penetrated places where these women are. So they don't necessarily know that they're pregnant and they should go and seek health care, and that there are going to be some important information and tips that they need to get in the early parts of their pregnancy. So really the job is to kind of reach people before they're pregnant and, after they've had their child, before they have their next one, to really kind of get that information to them. So I think what will be interesting about Text for Baby is looking at what happens to all the women that are postpartum before their next baby. Are they more likely to now go get care earlier because they got this information and they were plugged in? And I hope that'll be the case. This is so beautiful, I think, because otherwise, if you don't get these messages, it may be very difficult to even know that you need to do that. And so when Text for Baby sends you a message and says, anybody that's taking care of your child should be vaccinated for the flu, they should be vaccinated for pertussis, which is whooping cough, it's important for you to figure out what to do with that information. And pretty much almost every Text for Baby message says, text this for more details, call this number for more questions, ask your provider if you need a little bit more guidance. So there's always that additional level of support for people that aren't sure how to take that information and use it. But I think that that's important. I mean, there are a lot of different barriers to getting people to do that. But if I'm a mother and I get this message and it says, anybody taking care of my child, puts my child at risk of getting the flu or getting whooping cough, then I'm going to go to the daycare, I'm going to go to grandma, I'm going to go to the other grandma and say, can you guys just get checked or get vaccinated? And I think that that's what's important. So. But I think Text for Baby is so empowering because just imagine the power that you give a young woman or a mother that's really not familiar with being pregnant. You give her a message on her cell phone and she can go to her midwife or to her doctor next time and say, I was told that I need to ask you about this. And, that's so empowering because she's getting information that is accurate health information coming to her cell phone, but it gives her something to go and talk about and start a conversation, as opposed to going to the office and the doctor tells her, do this, and she takes it and she goes home. She's actually now being able to ask the questions. Okay. One of the areas I think that Text for Baby could improve on is the frequency of the messages. I think that they are right on time and they always seem to come in kind of right when your baby's about to reach another stage or when you're going to another stage of the pregnancy. But I think that messages could be more frequent. I think that there are a lot of space between even those weeks, those days where there's information that is important for women. So kind of drilling it down to information by not only week of pregnancy, but maybe even kind of part of that week in pregnancy would be important. And then I think a huge important part for them is going to be data collection. So trying to look at impact of this program. First of all, how many women did we reach? And if there's any way to kind of survey the women that they have reached out to, trying to identify the satisfaction of the consumers with the tool. But I think that Text for Baby is onto something. Many countries in the developing world are trying to figure out how do we get messages to people. And if you look in many of the developing countries, I think the statistics say about 80% of people have cell phones and less than 20% have actual landlines. So if you think about text messaging as a tool to actually empower and educate women all over the world, I think they're really, really onto something. So I think just even thinking kind of broader than the United States. Obviously getting it down in the United States and the countries that they're in right now, but thinking about broader and developing countries is important. I think it would be a good idea for Text for Baby to actually engage dads. I hadn't actually thought about that, but I think that it would be important if there was a way to get the same messaging to dads, particularly some of the things that are very uncomfortable for people to talk about. Some of the messages that you get from Text for Baby after you've had the baby are about postpartum depression, which is an area of major stigma in many populations, particularly minority communities. People just don't talk about having postpartum depression because they're scared they're going to lose their child, that the state will take them away if they think that the mother is depressed, or they're scared. People think you just had a baby, you should be happy. Why are you sad and why are you crying? So people think it's abnormal. So that's an area that Text for Baby sends a lot of messages about, to encourage people to get help and kind of break down that stigma for them. And I think it would be a lot easier for women that are having trouble kind of in that postpartum period, either with depression or challenges when they're breastfeeding or not sure what to do with emotions, if the dads were also getting some of those messages as well. Okay. So Community Health Center is the largest network of health centers in the state of Connecticut. We have over 130,000 patients throughout the state, delivering medical, behavioral health, and dental services to a predominantly underserved population of patients. Over 60% of our patients are racial and ethnic minorities. Over 90% are at or below 200% of the federal poverty level. And about 25% of our patients don't have insurance at all. So we are particularly challenged with how to reach patients and give them access to care and give them access to high quality care at every encounter. In our prenatal departments, we deliver about 700 babies a year, and each and every one of those babies is important to us, and each and every one of those mothers is important to us. So those mothers often end up becoming patients and staying on as patients, and those children end up becoming part of our family. So it's very important to us that we start educating kind of from the time that the mother is pregnant as the child grows up, and we take care of them through their life. Awesome. Hello, my name is Dr. Olayiwola. I'm a Chief Medical Officer of Community Health Center, Inc., which is the largest network of health centers in the state of Connecticut. Every year, we deliver 700 babies in the state of Connecticut, and I'm very excited to talk about a new program that's been designed to help these women. Text for Baby, which is found at www.textforbaby.org, is an innovative program to bring text messaging to women who are pregnant and postpartum during the first year of life for their babies. I've been so impressed with the caliber and quality of the messages that are delivered and provides right-on-time health information to women during the stages of their pregnancy. Registration is very easy. Registration is very easy. You text 511-411 and use the word baby in English or bebe in Spanish, and you will get 2 to 3 messages every week that will give you important information at your stage of pregnancy or at the stage of your baby's life. It's been very exciting for me as a physician, giving this information to my patients, and also very exciting for me as a mother.